welcome to another win and fail. That looks disgusting. Okay. Welcome to another win and fail. Yes. Okay, so today we're gonna be doing surgery games, and if I fail, I'm sorry. I'm just gonna kill them. So I'm gonna do ones I never did before, and yes, I'm gonna do it because that's disgusting. And so why don't we try this one? A root canal. Ew, look at that baby. Okay, hurry up and load because this thing is so slow. Come on now. Okay, I need to get this out of here because I was doing something. I got a smile button. And as you can see, I have a new intro. As you can see, it's kind of stupid because it's from Bandicam.
Welcome to Surgery Squad's virtual root canal procedure.
It's loud.
I'm the one and only Dr. Jeff, and I'll be helping you with this surgery today. A root canal is an endodontic dental procedure that's used to repair and save a decayed or infected tooth.
That's disgusting.
A root canal is an endodontic. Before we begin, would you like to review some of the common myths and misconceptions surrounding root canal treatment?
No.
No problem. Let's move on.
Okay, dude.
In effort to make our
that
patient
mouth.
as comfortable as possible, we need to inject a local anesthetic into their gum line.
I hate it
But
when they
first,
give you shots
apply
in your
a
gums.
topical numbing
It's
gel
just
to the
disgusting.
injection site.
And it hurts.
This will help reduce any discomfort the needle may cause. Next,
Ew.
we can inject the local anesthetic.
I can't look.
After the local anesthetic has taken effect, the area should become numb for a few hours.
Why is that guy moving his tongue
Use
like
the
so weird?
syringe to inject the local anesthetic into the
Sorry about the
patient's gums.
background. It's my
Just
grandma.
below the tooth we'll be performing a root canal treatment on.
Ew, I can't look. Ew, ew. Ew. Look at his tongue. It was like,
Let's give our patient a few minutes to relax and for their mouth to become completely numb.
Usually when they say numb, it's not really that numb. Okay, get to 5 minutes later because I'm not waiting 5 minutes to get it 5 minutes later.
Now that
Ew.
the patient's mouth is
Looks like
numb,
my dad.
we can move on to isolating the tooth. Since our patient's saliva contains contaminants that we don't want getting into the tooth, isolation is a critical step during root canal treatment. To isolate the tooth, we need to punch a small hole into the rubber dental dam and place it over the tooth.
I don't know what to do.
Once the rubber dam is in place, put on a tooth clamp to keep it from moving.
I don't know what to do.
Next, we'll need to dry out the tooth as much as possible using our air-water syringe.
Air water syringe.
So far, so good. Now that the tooth has been isolated, we can create our access cavity in the tooth using our drill.
But the tooth looks fine. I don't see why they're doing this. Ew. Ugh.
The next
Ew.
step is to clean and shape the tooth's canal.
Ew,
using a
ew.
root canal file. Go ahead and give it a shot.
The heck?
At this point, the dentist would measure the depth of the canal using a combination of x-rays and specialized equipment. If a dentist fails to measure properly, it could mean that the tooth would be at risk for reinfection.
Well,
Now
that's
we need to clean the canal of the tooth using sodium hypochlorite, commonly known as bleach. We'll let the bleach sit in our patient's tooth for about 5 minutes to make sure that all the bacteria and tissue inside the tooth has been dissolved.
Okay, you do that. Hurry up and get 5 minutes later. I don't wait 5 minutes.
Now use the suction to
Thank you.
remove the bleach from the patient's tooth.
It just like
Next,
disappeared.
we'll need to fill the tooth using a rubber compound known as gutta percha.
Gutta
Gutta
percha.
percha is often
Gutta percha.
formed as tiny, thin cones that we'll insert into the clean canal of the tooth.
Gutta
I've
percha.
already added some sealant to the gutta percha cone. Looking good. A heated instrument is now used to remove the excess gutta percha.
Let's just press it in there.
Pack the gutta percha into the tooth canal using a plugger. After the gutta percha has been placed,
Gutta percha,
it's
y'all.
common recommend that additional x-rays are taken to verify that the canal has been adequately sealed.
He looks like some kind of...
Once the dentist verifies that the canal has been sealed, a filling or crown is placed, depending on the location of the tooth. You can learn more about fillings and crowns in our virtual dental filling and virtual dental crown procedures here on SurgerySquad.com. After a root canal, patients should expect some mild sensitivity and discomfort.
Okay,
This
I'm
can
done
usually
playing
be
this game. So we're gonna play one more and then we're gonna just like go. Okay, let's do this nasty one. The nasty colonoscopy. My grandpa has to get one of these soon. Ew, what the heck is that? Okay, that is disgusting. Be back when it loads.
And welcome
Okay, it
to
loaded.
Squad's virtual colonoscopy. I'm Dr. Jeff.
Colonoscopy.
And I will be guiding you through this colon today. Also known as the large intestine, the colon is responsible for the final stages of the digestion. It
Which means
absorbs
poo-poo,
remaining
poo-poo,
water and
poo-poo.
electrolytes from indigestible food,
Poop,
accepts
poop.
and stores food remains that weren't digested in the small intestine, and eliminates solid waste from the body.
Yeah, that's
A
poop.
colonoscopy allows your doctor to view inside your entire colon using a device called an endoscope. As the scope moves into your colon,
A what-y
your
scope?
doctor views the output on the monitor to check for growths or polyps. There are several parts to the colon. The cecum ascending, the
Cecum
transverse,
ascending,
the
transverse,
descending, and the sigmoid.
Insetting and the
A
sigmoid.
colonoscopy can check each one of these areas. The one thing about having
Ew.
a colonoscopy is that a doctor can find polyps and remove them immediately.
That looks
This
like
is the most
your
effective way
uvula.
to prevent the development of colorectal cancer. However, you'll need to cleanse your colon 24 hours before the test by taking laxatives or performing a fleet enema. Also, use of the endoscope might accidentally tear the colon walls and cause bleeding. Plus, you'll need to be sedated during the exam, which should take about 30 minutes or longer if any polyps are found. We have a 53-year-old female waiting for her colonoscopy. Let's get scrubbed and take care of this. Our patient is lying on her left side, knees drawn up to her stomach. She's wearing a gown, and we have a sheet draped over her. Let's set her up with an IV drip of the sedative.
Okay. Is it that vein or is it this one? Oh, it's that vein. I hate getting IVs. They like hurt.
Great.
Tape,
Now
like
we'll
tips
wait a
can
few
hold that.
minutes for the sedative to take effect. Our patient is
Look at her butt.
She stated that she's cleansed her colon, and I've already used a lubricated, gloved finger to check for blockage.
Ew. You
Be
just
sure
put
to
your
tell
finger
the
up her
patient
butt?
that she should breathe slowly through her mouth to relax her stomach muscles if she feels cramping. We'll insert the endoscope into the anus and slowly move it into the colon. The endoscope contains a small camera and light, and a pair of forceps so we can remove any polyps we find. First, let's lubricate the scope for easy insertion and passage through the colon.
That sound though.
Carefully insert the scope into the patient's anus and slowly
Butt
move
just
it
said
into
butt.
the colon. We can watch the camera's output on the monitor. We're in
What?
the rectum now.
I'm playing a game.
Let's move on into the sigmoid
Now
colon.
I'm recording.
Slow and steady. You're doing a great job. Descending colon's next. Now's a good time to remind our patient to breathe slowly through her mouth as we do the exam.
Look at the poop.
All right, let's move into the transverse colon. Uh-oh, looks like we've got a small polyp in the transverse colon. We'll use the forceps to remove it. Fine work. We'll need to remove the scope so we can bring the polyp out. First, let's use some heat to cauterize the spot and try to stop that bleeding. Fantastic. Let's slowly withdraw our scope and get that polyp out. Let's go back in to check the rest of her colon. Remember the name of the colon where we found the polyp? That's
No.
right, the transverse colon.
Oh. That sound. Come on.
Back in the transverse colon now. Everything's looking fine, and you're doing a great job. Now's also a good time to remind our patient to breathe through her mouth slowly.
Breathe
Moving
through your
now
mouth
into
slowly.
the ascending colon. And there's another one. Let's take it out the same way we did the others. Back in the ascending colon now, and we move into the cecum. And all looks...
Trying to brush teeth. Listen.
She might feel bloated or need to pass gas. And since we removed 2 polyps...
Okay, we're done, bros. Hope you enjoyed this swag video. If you want to see my face, you can see my swag face. And yas. So I already did all the surgeries probably. Ew, there goes face. Oh my gosh. Let's see here. Okay, here I am. Hello. And yas. So I was just playing that game and I was like, okay, because it was really disgusting. So peace out, my lovers, and good night. I have to get braces. So have a good day, bruh.